welcome to Feminine Focus. I'm your host, Fausat Junado Hassan. Today we'll be raising awareness about women's health, talking about a critical issue that affects women worldwide. I mean HPV and cervical cancer. We'll explore the facts, the risk, and the power of prevention. Let's get started.
Every year, thousands of women in Nigeria face a silent threat: cervical cancer, caused by the human papillomavirus HPV. This disease is preventable but often undetected until it's too late. Cervical cancer is one of the most common cancers among Nigerian women, claiming thousands of lives every year. The human papillomavirus, or HPV, is the primary cause of this disease. But what's HPV and how does it lead to cervical cancer? HPV is a sexually transmitted infection that's incredibly common. Most people will contact it at some point in their lives, but for many, the body's immune system clears it naturally. However, in some cases, the virus persists and can lead to abnormal cell changes in the cervix, potentially developing into cancer over time. The good news is that cervical cancer is preventable and treatable if caught early. Screening programs and HPV vaccines are available, but awareness and access remain challenges in Nigeria. Experts says education, vaccination, and regular screenings are key to reducing cervical cancer deaths. The HPV vaccine is safe and effective, and screening can detect abnormal cells before cancer develops. For women in Nigeria, knowing the risk and taking proactive steps can save lives. Today, we will dive deeper into HPV and cervical cancer with our guest. We will uncover the risks, the realities, and the steps women can take to protect themselves.
Welcome back. That report highlighted the importance of awareness and prevention when it comes to HPV and cervical cancer. Joining me now is Fatima Yakubu, a medical microbiologist. She is also a founder of the health initiatives known as the Green Garnet Fight Against Infections Initiative. Also a lecturer at the Nigerian Defense Academy and a researcher in infectious diseases with expertise in cervical cancer prevention. Thank you for being here.
Thank you so much for having me. Thank you.
All right, let's start with the basics. What are the common risk factors for cervical cancer and how can women reduce their risk?
Cervical cancer, as we know, is usually comes from exposure to the HPV, which is the human papillomavirus. Okay, so this virus, the risk factors for this is early sexual exposure, um, sexual activity with multiple partners. Smoking is also a risk factor, and a weakened immune system is a risk factor for cervical cancer. So, women, it is important that we try to mitigate these risks, and what we can do is ensure that the inverse of the risk factors is what we should do. That the early sexual activity should not be encouraged. For sexual partners, you should abstain or just have one sexual partner, and also smoking. Um, Smoking is an important risk factor for HPV and by extension cervical cancer. So smoking is not good for the body as women and as individuals generally, and also a weakened immune system. Other infections that can arise that can weaken our immune system give way, open the way up for the virus, the HPV virus, to attack our bodies and by extension leading to cervical cancer. So all these are ways that we can mitigate these risk factors and see that we prevent this HPV and cancer, cervical cancer.
Okay, are there vaccines available for HPV? If yes, how effective is the vaccine and who should get it?
Yes, vaccines are available for HPV. Vaccines are available for HPV, and these vaccines have been shown to have a success rate of up to 90%. Uh, Girls of young girls between the ages of 9 and 14 are encouraged to get this vaccine. Older adolescents can also get this vaccine, and this vaccine is usually given as a single dose. The Ministry of Health in Nigeria, in partnership with the National Primary Health Care Development Agency, also have come up with this vaccine schedule that started in October 2023. Okay, so the aim is to vaccinate as many young girls as possible so that this cervical cancer is nipped in the bud. So just vaccines are available for the HPV. HPV vaccines are available.
All right, what screening methods are available in Nigeria and how often should women get screened?
Okay. Um, for the screening methods, we have the pap smear, something called the pap smear. We also have the HPV DNA testing method, and then there's the visual testing method where we test using acetic acid. So the pap smear essentially tests for abnormal cells in the cervix. It doesn't test directly for the virus. The HPV DNA tests for the presence of the virus. So that one is highly specific. For the pap smear, it's usually recommended to be done every 3 years, while the HPV DNA testing, it is recommended that we do it every 5 years. For increased sensitivity and better outcomes, there's the co-testing, which involves the merging of the pap smear and HPV DNA testing. So this gives better results and better outcomes.
Okay, I believe there are symptoms of this HPV, or let me say cervical cancer. So, what symptoms should women watch out for?
Early stages of this cancer usually are asymptomatic. They don't present with any symptoms, but late stages present with symptoms such as excessive bleeding, abnormal vaginal bleeding. Also, you have pelvic pain, and although these symptoms can be symptoms for other conditions as well, so it's important that when people get these symptoms, such as the pelvic pain, like I've said, and excessive vaginal bleeding, they reach out to their healthcare provider, who will be in the right position to direct them towards the necessary steps further.
Okay, talking about how this virus can be transmitted, how is HPV transmitted, and can men be carriers?
Yes, very important question. The transmission, yes, HPV can be transmitted via skin to skin sexual contact. It is interesting to note that the exchange of fluids does not necessarily have to occur for this virus to be transmitted. So long as there's this skin to skin contact, this virus can be transmitted even via little cuts on the skin or any little opening. So it's transmitted that way. And also, men can be carriers of this virus. Unlike women who can see some symptoms, men are generally asymptomatic. They don't show symptoms, but they carry the virus. So vaccination is important. Shared responsibility is important. Maintaining one sexual partner abstinence first and maintaining one sexual partner, it's important because if man is carrying this virus and without symptoms, it is not known that this person is carrying this virus. You can imagine how much spread this can cause. So vaccination, like we have mentioned before, is important because if you are vaccinated against this virus, any exposure will be able to, your body will be able to fight such exposure. So vaccination is important, and also shared responsibility as individuals.
All right, from all that you've let out, HPV seems to be a very dangerous health condition. Then, can HPV be treated or is it a lifelong condition?
Unfortunately, the virus itself cannot be treated. The virus itself cannot be treated. It is the infections that the virus is caused that can be treated. For low risk HPV infections, we can have things like genital warts. Okay, so these genital warts can be treated. High risk HPV infections are those that now progress to cause cancer. So it is this cancer that can be treated. It is this the abnormal cells in the cervix that can be treated. But the key is in early screening and early diagnosis. So the earlier one goes out to screen, the earlier one presents himself or herself for screening, the better the chances of treatment. So the virus cannot be cured. It is the infections that it causes that can be cured.
Okay, let's bring the conversation back home. How does Nigeria compare to, other countries in terms of cervical cancer rates and their outcomes?
Compared to other countries, Nigeria has high cervical cancer rates and low outcomes. Globally, Nigeria ranks 7th in the incidence of cervical cancer and deaths from cervical cancer. Bringing it to the regional level, in sub-Saharan Africa, Nigeria ranks first, the highest in cervical cancer rates. So compared to other countries also, we have poorer outcomes because we have high mortality from cervical cancer compared to other countries, and this is usually because of late presentation, late diagnosis, expensive vaccines, and all these factors come together to make it makes it quite devastating for the Nigerian scene. But then with investment in prevention, the outcomes would look better. Like the government is in partnership with several bodies to see that this vaccination is taken to all people that need the vaccination. I'm sure in the nearest future, these statistics will be better.
What are the biggest challenges in preventing and treating cervical cancer here?
Here, the biggest challenges I would say are low awareness. There's low awareness. There's also that late presentation, like I said, when the cancer has reached a very late stage, most times that is when it is usually diagnosed. And also low screening coverage. Okay, it's also a challenge because if you don't have enough facilities to screen, a lot of people will be with this virus. They wouldn't have opportunity to screen, and then this can present as a problem, a major challenge. And then the cost of the vaccine itself is a major challenge. And when we talk about people in the rural areas, you find that they have hindrances to access these medical facilities. They have hindrances to access the screening facilities. And generally, by and large, is a matter of access and funds to do all these screening tests. So these are challenges that the federal government is working so hard to see that the gap is bridged.
Okay, I guess our viewers out there are watching us right now and are now in haste to get screened. So, what message do you have for women who are hesitant to get screened or get vaccinated?
The message I'd like women to take is that screening is self-love. Screening is self-preservation. Screening is self-protection. You need to get screened. Screening helps you know your status when it comes to the HPV and cervical cancer. It helps you know you don't have this virus and you don't have cervical cancer. It also helps you know early in case this virus is in your system, because early detection, early diagnosis saves lives, makes a whole lot of difference. So screening is self-love. You need to do it for yourself.
Okay, I want to ask at this juncture if screening is free or you have to pay from your pockets.
Okay, there are foundations that usually come up with programs that provide free screening services. Also, the government also come up with programs such as the visual inspection with acetic acid. Yes, that was done by the government some time ago, and it offered free screening to women. So usually programs like this are usually set up for free screening, but you have health medical organizations or hospitals that run these screening tests for a fee. So if the government's arranged free programs, does not reach you, you can also walk into any accredited hospital for screening at a fee. Thank you.
All right, let's take a look at the future outlooks. Since women watching us are in haste to get screened and vaccinated, are there plans to improve access to HPV vaccines and screening in Nigeria?
Yes, there are plans to do so, because not having access to these vaccines largely comes from lack of funding. But the federal government, in partnership with bodies like the Bill and Melinda Gates Foundation, Gavi, the Vaccine Alliance, also the WHO and UNICEF. All these are strong players in the health sector, and the government's partnership with them is just so that the access, okay, and the availability of these vaccines become very easy for people in Nigeria to get. So yes, there are plans and there are steps that are being put in place and steps that have been taken to ensure that these vaccines are, go around. Because the plan is estimated that by the end of 2025, we have 16 million girls already vaccinated against HPV. So I believe that is a very good step in the right direction.
All right, what call for action do you have for women out there?
I'd like to add here that the HPV it's not a death sentence. Cervical cancer is not a death sentence. It can be cured, it can be treated. The important thing is that it should be diagnosed early, and early diagnosis comes when we present ourselves for screening. Screening women from 25 years of age can go to screen. You can go for the pap smear, or you can go for the HPV DNA testing. But whichever one you choose, at the end of the day, the bottom line is that you should get screened. Okay, screening helps for better outcomes. So for the sake of our health as women and the society in general, it is important that we take screening serious. So cervical cancer month was in January, but like we always say, awareness does not stop. Regardless of if the date set aside for it has passed, awareness is a continuous thing. So it's important that we make people aware of these these issues, such as HPV, as we're discussing right now, because awareness goes a long way. So take-home message for we all today is, if you have not screened yourself for HPV, please make it a duty to do so. Thank you.
All right, thank you so much, Fatima Yakubu, for sharing your expertise on HPV and cervical cancer. Your insights are quite invaluable.
Thank you so much for having me. It's been such a pleasure. Thank you so much for having me on Feminine Focus.
For women out there who might be interested in getting screened or, vaccinated, you can reach out to any accredited health center near you. Have you or someone you know been affected? Share your stories or questions with us. We'll be back after this break. Stay with us.
I unfortunately happen to have lost somebody very dear to me to cervical cancer a couple of years back. And I have resolved that I'm going to be at the forefront of this cervical screening. Cancer, as you know, is a killer, and in fact, a silent killer. And as you know, cancer is not something that anyone will want to have. It's important that we look in that direction. Our women are dying. Cervical screening, it's a must for every Nigerian woman.
One of the days that cervical cancer kills, it no longer kills, because we believe that prevention is better than care. If you are screened on time and detected, there are managements. There are ways in which you can go about it. There are treatments. It no longer kills. Please don't keep quiet. Don't hide yourself. Come. We have screened over 60 this morning now, and we have seen a lot. And we have been directing them to where and where they can get treated. There are vaccines for it. Once we have a true cause of the vaccination, I believe you are immunized.
We really need it as women, because we know the importance of cervical cancer and what it can cause.
From time to time, you should check your health. And instead from the test, you should be able to see a qualified medical practitioner. That doesn't stop you from praying. That doesn't stop you from exercising your faith, but it is wisdom that you should subject yourself to medical analysis from time to time so that your health will not be compromised.
Thanks for sharing your stories and thoughts with us. Now, here are some simple steps you can take to protect your health. Don't go away. That's all we have for you today on Feminine Focus. It's important you know that cervical cancer is preventable and that screening saves lives. Until next time, stay informed and stay healthy. Goodbye.